Some people have dry eye and yet they have no symptoms of dry eye. They could have dead glands and poor tear production and yet they have no symptoms. Yet some people, like myself, don't really have bad clinical signs of dry eye but have horrible symptoms. And I always used to wonder, why do people have different levels of pain? I think now I'm beginning to realise why people have different pain thresholds. Most of the time, if you have dry eye and it's not that bad but your symptoms are bad, optometrists will usually say that, oh, okay, you have neuropathic pain and the pain's coming from your nerves. And your nerves are part of your nervous system. What controls the nervous system? The brain. It's the perception of pain that's creating the difference in the pain that different people experience. When you have dryness on your eye or something irritates your eye, the nerves of your eyes pick up on that and they send a signal to your brain. Once the signal is to your brain, the brain determines how dangerous this pain signal is. And the more dangerous the brain perceives this signal to be, the more pain you're going to be in, because it's trying to get your attention. Because the brain's purpose is to keep you safe. That's why pain exists. Your brain wants to keep you safe, so it creates pain signals to get your attention, to fix what's wrong. But sometimes there isn't anything wrong. So how can we use this information to help us? If you have symptoms and you panic because of them, your brain perceives that as a threat. It thinks that there's something wrong with your body, so it produces more pain to try and protect you. Pain reduces when your brain feels safe. So if you do have symptoms, I know it's hard, but you have to try your best to get on with your day and try and be indifferent about the symptoms. So think to yourself, oh, okay, my eyes are burning, but it's just my brain perceiving danger. That's not actually there, and I'm going to continue on with my day. Because when your brain realizes that you don't really care about the pain that's being generated, it's more likely to stop the pain because it knows that there's nothing wrong because of your reaction. Some people would argue that this is psychological, but I would say that it's more neurological because your brain has conditioned responses from childhood, from its life experience, but these reactions are plastic. The pain that you can experience can also be plastic, so in a way you can rewire your brain to not have these conditioned responses of pain anymore. So this mind and body stuff is also called TMS. It's based off of Dr. John Sarno's book. I think it's called Mind Over Back Pain, and he used these strategies to treat back pain. There's also a book by Alan Gordon called The Way Out, which is really good, which is also about mind and body connection. So this mind and body stuff has really helped me with my other symptoms that I've been having within my body. So I'm hoping that it could also help my dry eye. And I just wanted to share this with people because I know that not all dry eye is going to be like mind and body connection, but I think in my case it largely is. I can make a video on why I think mine's mind and body related, so you can also see if your symptoms might be mind and body related. Like, I know some people have physical problems with their eyes, but with me, I've literally been told that my eyes are perfect, so this is kind of like my only thing that I have.